every other policy now has to cover. 2018, there will be a 40% tax on the Cadillac plans. You've heard of those. And in 2020, the Medicare donut hole will be closed. So that's the prescription benefit that Medicare employees get now. Okay, a lot of things with the Affordable Care Act, but that's it. I mean, that really covers the highlights of what it all means. So what's that mean for individuals? And again, I'm going to try to take the perspective here of sort of as a business owner, as a business in healthcare, but also what does it mean on an individual level? In 2014, only 55% of firms offered health benefits to their employees. I found that to be lower than I would have expected. And of those firms, only 62% of workers are covered. And Walmart just made their big announcement that they're not covering employees that don't work more than 30 hours. So a lot of companies that offer benefits don't offer benefits to everyone. The average deductible is $1,200 for a family policy. And this year, the average family policy premium is $16,834 for family of four. That's up 69% in the last 10 years. Employers pay, on average, 71% of that, and the employee pays 29% of that overall cost. And that ratio has been changing. So employers are starting to cost share more and more with their employees, and the cost of care as it becomes more expensive. Well, along comes the exchange, which is available then to individuals and small companies, less than 50 employees. 76,000 people signed up, as I mentioned. 42% of those were under age 35. 54% are female. 70,000 of those, so 92% of the total, gets some kind of subsidy. So the vast majority of people on the exchange got some kind of a subsidy. There's two parts actually to the subsidy. I'm not an insurance agent, but basically there's the premium tax credit, so that's the credit you get for paying the monthly premium. And then there's also cost sharing with the deductible and co-pays. So there's two different parts of cost sharing. Depends on what your income. That brought our insurance rate down. So before this year, Idaho's uninsured rate was 19%. It's now 16.2%. So it's improved somewhat. Medicaid expansion would be estimated would reduce that another 5% at least if we were able. 60% of the newly insured have used their benefits already. And what we've seen in our office mostly has been preventative services and contraceptive services. So a lot of people are getting their preventative care, which I think is a good thing. 2/3 of the people on the exchange are happy with it. 70% are now confident that they can get care. So it's been a success. More than 2/3 of adults making less than $28,000 paid less than $125 a month, which is similar to employer plans. So it really does make it affordable. So, since this is an economic forecast forum, I'm going to give an economic forecast overall for individuals, partly sunny. Partly sunny for those, at least, that are making over 100% of the federal poverty level, but still stormy for those that make less than 100%. And if you're interested, 100% of every federal poverty level for individuals, $11,690 this year, and for a family for $23,850. What about employers? Premiums increases are slowing, probably, as I mentioned, due to the general economy, down from our historic increases. 150 million Americans are getting their insurance still through their employer, but employers treat compensation as a single expense, whether it's your wage or whether it's your benefit. And so, essentially, total healthcare spending erased all wage gains for the typical family over the last decade. And what we're seeing, of course, is that it's it's tougher and tougher to increase wages as an employer if your healthcare costs are still going up so fast. Fortunately, small employers like myself, I have 15 full-time equivalents at our office. Small employers can now opt to have their employees go to the non-group coverage on the exchange. And that's what we did. At our office, we discontinued our health plan and gave everybody a raise. We gave everybody, on average, $100 a month raise. What that did, and I'm just going to use this as an example because I know a lot of you run businesses that are similar in size perhaps to what we have. What that did for us, comparing to 2013, our clinic expense for healthcare was $33,500. Our estimated expense, that is because now we gave a raise to all of our employees, is our annual for this year is going to be $16,650. So we cut our expense in half. What did that do for our employees? Because that's part of being community is providing good jobs, right? Good jobs and have benefits. And this was something that was difficult for me to come to terms with the fact that we weren't going to give our benefits, our employees benefits. But here's what happened on the exchange. So just using a couple of examples, we have an employee who's married, has 2 minor children. They were previously, the cost to the employee for their family was $522 a month. It went down to $90 a month on the exchange, and they got better insurance. So previously, our policy was $1,000 deductible. They now have a $150 deductible and a $10 copay for $90 a month. I have an employee that's a single mother with a single minor child. She is now paying $30 a month for a no deductible policy, $10 copay. Now, these are some of my lower compensated employees. My higher cost employees, a married couple with 2 adult children, children that are still under 26, so they're still on their parents' policy, even though they're grown. She actually increased the cost. Previously, we were paying, or she was paying $120. Now she's paying $277. Remember, we gave everybody a $100 raise per month, so it almost evens out. But she gets much better coverage than what we were able to afford before. So for small business, the exchange really can be a winning situation. So I just wanted to use that as an example. Okay. I told you I was going to talk about the improving economy and how that might influence healthcare and the cost of healthcare. So I'm going to give you an example, which is hepatitis C. Hepatitis C is a level B recommendation for screening anybody who was born between 1945 and 1965. Okay, that's most of you. Hepatitis C is the most common blood-borne infection in the world. 260 million people worldwide. About 75% are in India, interestingly enough. 3 million people in the U.S. are infected. 75% of them don't know. Most hepatitis C infections become chronic, 75 to 80%, and cause about 10,000 U.S. deaths per year. The overall prevalence is 1.6%, but the peak prevalence is 4% in people 55 to 60 years old. Okay, for those of you 55 to 60 years old. The risks of acquiring hepatitis C primarily are the same as hepatitis B and HIV, which is injection, drug use, blood transfusion received before 1992, hemodialysis, incarceration, intranasal drug use, unregulated tattoo applications. The long-term complications include cirrhosis, 20%, hepatocellular carcinoma, 4%, and liver failure. Hepatitis C is the leading cause of liver transplants in the U.S. So in June, it became a grade B recommendation that everybody should be screened. Sounds like a good idea. But up until late last year, only about 10% received full therapy for hepatitis C, primarily because it was a lengthy course of treatment, 48-week treatment. It was injectable, it was poorly tolerated, you feel like you had the flu all the time, and the cure rate wasn't very good. It was less than 50%. You go through all that, less than 50% chance you'd actually benefit. However, there's a new medication on the market. You've probably heard of it, called Sovaldi, or Sofosbuvir, and it comes in a combination that's a 12-week oral regimen that has a 90% remission rate, and it's well tolerated. You don't feel like you have the flu all the time. So this is a huge breakthrough. However, it's $84,000. It's $1,000 a pill. Okay? And it's estimated that that drug alone is going to add $200 to $300 per year per policy for the next 5 years. Okay? That's for everybody. Everybody's going to pay $200 to $300, whether you have hepatitis C or not. They're going to pay more because now there's treatment available. It happens to be pretty expensive. It works, but it's pretty expensive. So the forecast, I would say, for small business is partly cloudy. I think there's a lot of good things that are coming, but there's, clouds in the air. Going forward, we may see our costs start to go up again significantly. Hospitals, talked about briefly, and just some interesting additional statistics. $492 million in unpaid hospital bills just in Idaho last year. People that don't have insurance, that show up at the hospital, need care, can't be turned away, given care appropriately, the hospital has to eat that. Hospital is facing a 2% cut in budget due to the budget sequester, the national sequester that happened. That was supposed to be made up by Medicaid expansion, but not in Idaho. Most of the savings that U.S. hospitals will have this year is in those states that have expanded Medicaid. And unfortunately, nearly all the small hospital closures in rural parts of the country have been in states that have not expanded Medicaid. Hospitals operate on a very thin margin. Most people probably don't know that, but it's in a single-digit percentage. Okay. So one more thing I'm just going to mention, and I'm out of time. Idaho, and perhaps you saw a little letter to the editor they wrote in the paper, could have saved $72 million in lower costs because the county pays for a lot of that indigent care, people that don't have coverage. If we had expanded Medicaid, $330 million would have come to Idaho in federal payments to doctors, to physical therapists, etc. Another $150 million would have come to our hospitals. It's about $480 million a year, or $4.8 billion in 10 years. For comparison, that's the same that we spend at Idaho state budget on all the colleges and universities in the state. We're not able to bring that money back to the state. 16,000 good-paying jobs would be created if we expanded Medicaid. That's the estimate. And of course, we're sending our federal dollars, our federal tax dollars, to other states for their health care. Estimated over the next 8 years, Idaho will send $1.2 billion in federal taxes to other states. So the overall economic forecast for the state, I put colder, rainy, possibly turning pale. There's a lot of financial stress on the state. Thank you for inviting me. Hopefully some of that was enlightening on the economic forecast.
Thank you. We had a lot of good information today. I am sure that the speakers will hang around for a few minutes if you guys have additional questions, since we're out of time now. But thank you for coming today and for your time and for your attention. Go out and have a beautiful weekend while the weather lasts.